Lazy eye or ptosis. Okay, so I am trying to figure out what is wrong with my eye. To me, it looks like one is bigger than the other. One of my eyelids has these small wart-looking things that I cannot figure out what it is. Please help.
Thank you for your question. You've submitted a photo and you're inquiring about a concern you have regarding the difference in the shape of one eye compared to the other. You also mentioned in your question a concern about a wart type of lesion, and you'd like to get some more information as well. Well, to give you a little bit of about my background, I'm a cosmetic oculofacial plastic surgeon. This means that my first area of specialty training was in eye surgery, and then I went on to do specialized training in cosmetic and reconstructive surgery of the eyelids, the orbit, lacrimal system. These are the areas around the eye. I'm also board certified in full body cosmetic surgery by the American Board of Cosmetic Surgery. I've been in practice for over 20 years, and I can certainly tell you that lesions around the eyes and ptosis, or drooping eyelids, or asymmetries, is something we deal with every day in our practice. So to begin with, when you present a question like this, the first thing I would say is I would comment on what I see when I look at your photo. When I look at your photo, the left eye in the inner aspect appears to be lower than when compared to the right eye. Now, when you make an observation like this, you have to ask further in consultation. In our practice, we ask about the history. Has it always been like this? Do you have you looked at previous photos of yourself, and can you see that difference having been present? Sometimes when we look at patients, we try to, essentially what we're trying to do is differentiate, is this drooping or ptosis, and ptosis meaning drooping, we're referring to the eyelid is eyelid ptosis. We're talking about a structure like the breast, it's breast ptosis. So in your case, eyelid ptosis, the left upper eyelid. We want to differentiate, is this congenital, in other words, you were born with it, or is it acquired? Is it something that's occurred later? Now, to understand, let's go with the understanding that you were born with this. Now, it's been our observation that patients who were born with the drooping eyelid, at certain points in their lives, that drooping eyelid can get a little bit lower. Sometimes what they've done is they've compensated for the asymmetry naturally, and eventually there's a little bit of a further descent. Now, this descent can be only a millimeter, but it can make enough of a difference so that you notice it. Within the normal population, it's normal to have a difference between the two eyelids in terms of the difference of 1 to 2 millimeters. The human body is asymmetric, and so we generally tolerate that without it drawing attention. When it's greater than that, it usually prompts people to seek attention, professional opinion. So without further information, I would say that you would need proper examination and diagnosis, but at least from the starting point, you have ptosis. In my practice for over 20 years, I have performed all kinds of ptosis surgery, from congenital or people born with it for helping with vision, to acquired or typically what's called myogenic ptosis or muscle-related ptosis. These are all different types of ptosis, and there's always a difference in the way you approach these based on some objective parameters that are determined during physical examination. So clearly you need to meet with the doctor in order to get the proper evaluation of this concern. Generally, people first see an ophthalmologist. Very often they also see someone, like in my specialty, an oculoplastic surgeon, and try to determine what the cause is. We also want to rule out neurologic causes, so those are also things that sometimes patients will see a neuro-ophthalmologist. So I think as long as you find one specialist to evaluate you, you should be led probably from that point forward in the right direction. As far as the lesion is concerned, although this is not a high-resolution photo, I believe you're referring to a lesion in the left lower eyelid along the margin. And although I can't see exactly, but it appears to be from a general perspective like like what's called a nevus, or a bump, which is like a freckle that you're born with. Again, without a physical examination, without three-dimensional view, it's really not appropriate to just say that without qualifying it. So again, meeting with a specialist is important to get the proper diagnosis. So I hope that was helpful. I wish you the best of luck, and thank you for your question.